I'm Victor Castro, and this is my presentation on the beverage model, specifically in Cuba. So, you may be asking yourself, what is the beverage model? Now, it's very basic. It's basically when the healthcare is completely free for all citizens and is paid for by the government. The government controls it. Like I said, it's completely free and is paid for with taxes. Now, there aren't many countries who use this. For example, the US doesn't do this. This is partially due to politics or it being too expensive and many things like that. Now, Cuba does have the beverage system, and other countries do follow it, such as Spain, England, and a couple others, but they all differ just slightly. For now, I'm just going to walk you through on how it works for Cuba. So, the way it works for Cuba is there's different tiers. So, first tier is the National Health Institutes and hospital centers. These kind of look at Cuba as a whole and all of its people. They don't really it's more like the general public. So, National Health Institutes, they do a lot of discovering new diseases, finding cures for diseases, research on pre existing diseases or illnesses, just all sorts of things. The health institutes were working really hard during COVID. Well, everyone was working really hard, but they were especially working hard as well. And then you start moving down this list. So then you go provincial hospitals, municipal hospitals, and these hospitals, as you go down the list, are getting smaller. So now we're at area health centers, and area health centers serve roughly 25,000 to 30,000 people. And then you go to sector polyclinics, and they're serving anywhere from 4,000 to 5,000 people. Then you have mini polyclinics, and they're usually just ran by a small team, like consisting of one physician, one doctor, um, a nurse, and then possibly a secretary. And they cover around 600 to 700 people, so not that much. Now, the problem with these mini polyclinics is that they're not very specialized. However, the good thing with them is that there's lots of them. So, and they're placed strategically so then every neighborhood is close to one. Cuba doesn't have very high salaries, so transportation is hard for some residents. So these mini polyclinics make it very easy for residents who can't afford transportation to get to their desired clinic, get the desired care they need. And then, but like I said, the problem with these mini polyclinics is that they're not very specialized. So if you have an illness that requires a more a specialist, you have to go to the sector polyclinics or even the area health centers, or you just keep going up the list until you get to the specialist you need. And then that's just kind of how it works. And then here's a quick video, kind of just explaining it. This is just a quick video, kind of talking about Cuba's health system.
Cuba way outperforms a lot of the countries in the global north in terms of health security domestically and internationally. And I think instead of always turning to states in the global north to be the role models for how to roll out universal health coverage or global health security, we can look to countries like Cuba to get these great examples and to have South-South knowledge transfer. So, for example, it's one of the only countries in the world that has eradicated polio and malaria and tetanus, and also it's the first country in the world to eliminate mother-to-child transmission of HIV. So it's really got this really strong history in infectious disease control. Yet it's also doing a whole range of stuff internationally around global health security as well, which I think is so important. And it raised the question to us of why isn't this being promoted as a great case study or a great example in the policy sphere or the academic sphere. One thing that is well established in the global health community is the strength of the Cuban national health system. It runs this fantastic integrated healthcare system, which is based in ideals of health education, health promotion, and prevention as the kind of key fundamental building blocks of the health system, which has meant that we've seen wide improvements of Cuban health across the population, much more so than other countries with similar development levels at the moment. So it really is kind of world leading in that respect. So when we think about internationally and kind of the role of Cuba in international or global health security, we can think about the medical internationalism programs that they run. So these are Cuban doctors who are sent by the Cuban government to work in a range of healthcare settings around the world, but particularly we've seen increasingly brigades sent to work in response to outbreaks of infectious diseases. So we saw this in the cholera outbreak in Haiti following the earthquake. We've also seen it more recently in the Ebola response in West Africa in 2014. And in fact, the Cubans were the first international brigade or international group to deploy to West Africa after the WHO asked for support in this way. So they really are at the forefront of pushing this international perspective around global health security. But also when we think about health security in Cuba, we've got to think about the strength of its domestic health security. That is, how is Cuba as a government able to prevent, control and respond to outbreaks occurring within its own borders? And actually the Cuban system is exemplary in this response. One of the current policy trends in global health security is tying global health security to a broader agenda of universal health coverage. And I think Cuba provides a really pertinent example for this because it really does have this strong universal health coverage offering. The fact that Cuba has this universal health system where people are able to access a doctor means that it provides a really great example of how these two agendas can be tied together. How is it that we can visualize a system where we have strong universal health coverage and strong health security? And I think it's particularly important with this tied up agenda to look to Cuba. Although it is a very unusual setting, and I don't think we should be necessarily suggesting it's replicable everywhere for different political differences, but maybe there are small policy traits that can be learned from this tied up agenda in Cuba and applied to this connected agenda more broadly.
Okay, so now let's talk about the problems with Cuba's health system. So, like any health system, there are flaws to it. However, Cuba's health system is not entirely the health system's fault. It's more of Cuba's economy and infrastructure's fault. So, the problem in Cuba's health system right now is there's limited supplies. So, doctors and nurses have very few supplies to work with. They don't have antibiotics, which can make it hard to treat certain patients. They don't have drinkable water, or they're very limited on the amount of drinkable water they can give. Don't have that much food. For example, now some clinicas are now requiring patients to bring their own bedding and food, which seems absurd, but it's a real world problem happening. It's a real problem happening in Cuba. And these problems are mainly happening in populated rural areas. Another problem is old equipment. So right now, Cuba, because obviously doesn't have a great economy, it can't afford the best equipment. So one example of this is that they have old X-ray machines that don't always work or don't have film available. They also reuse certain equipment that needs to be sterilized. For example, they reuse syringes or even other things, and they sterilize them. However, with that, there's always the possible risk of them not being sterilized properly, and then there could be a possible infection. And then this all is happening once again just in these rural areas. You don't really see them in the big cities. It's mainly in the rural areas. Now, here's a quick video just kind of demonstrating a first-hand example of how someone is affected by the limited supplies. So, here we go.
At Meridian, caring for what matters.
Near empty pharmacies in downtown Havana, a remarkable scene in a country that has for decades been known for high-quality healthcare. Like Edgar, thousands of Cubans struggle to find the medicine they need.
In the state pharmacy, a box like this costs about 40 pesos. But they're all out of stock, so I have to buy them on the black market for 250 or 300 pesos.
Edgar has diabetes and high blood pressure.
You can go to the doctor, he'll give you a prescription, but then you go to the pharmacy and there's nothing there.
Like many Cubans, Edgar dares not criticize the government on camera.
If you say how things really are here, you'll have problems with the police.
And yet for decades, Cuba has trained more than 500,000 doctors and nurses. During the pandemic, 30,000 medical professionals were deployed on missions throughout the world. Despite the economic crisis, Cuba continues to invest in people.
I don't have to pay for my studies, for accommodation, or for food. It's incredible. I don't need to pay a thing.
Kuslin arrived here 4 years ago, along with 10 other Mongolians. The Cuban government covers all the costs of their studies. The future doctor plans to return to Mongolia to work after she graduates.
The most amazing thing is that when we finish, we don't stay and work in Cuba. Cuba doesn't benefit from us. We'll all go back and practice medicine in our own countries.
In Cuba, according to official figures, nearly 1% of the population is a doctor. But with salaries that pay less than $30 a month, part of the health workforce have decided to switch jobs or immigrate. Last year, 240,000 Cubans, most of them young, left the country.
So, as you heard from this, one of the persons was affected because they couldn't get their hands on medicine, and then they had to go to buy it at the black market for way more expensive. Another thing you heard is doctors get paid very little in Cuba, and that is true, and we will look at it further into the presentation. So let's just go on to comparing Cuba and England's health care. All right, so on the left side we have Cuba, on the right side we have England. So I'm just going to go down the list, and the infant mortality rate for children under the age of 1 is 3.99 per thousand. On England, it's 3.65 per thousand. So England is slightly lower, which is good. Life expectancy in Cuba is 77.8 years old on average. On the other hand, in England, it's 81.4. So once again, England just a little better. Now, this is the crazy thing. Cuba has 84.27 physicians per 10,000 people. Cuba has the biggest physician ratio to people ratio. Now, England has 31.71 physicians per 10,000 people. Now, this is still a very good ratio, so not bad, but Cuba just takes this one. Cuba did a very good job with measles vaccination by the immunization by the nationally recommended age, 99%. England, 87%. HIV immunization coverage among 1-year-olds, 99%. 92%. Now, Cuba has 11% of its GDP going to health expenditures, and then England has 10%. Just one thing to keep note of this, although Cuba has a higher percentage than England, England's GDP is significantly bigger than Cuba. So England is spending way more on health than Cuba is. However, Cuba is spending a bigger percentage. Now let's compare Cuba to Spain, another healthcare system that uses the beverage like system. So I'm not going to read Cuba because you already heard that, but Spain's infant mortality rate is 2.56 per thousand, which is great. Life expectancy is 83.2 years old, also great. Now Spain has 45.77 physicians per 10,000 people, which is great as well. The measles immunization by the nationally recommended age, 92%. HIV immunization coverage among 1-year-olds, 93%. And then current health expenditure percent of GDP is 9%. So less than Cuba, but once again, Spain has a higher GDP than Cuba, so they are spending more than Cuba. Now let's go on to cultural differences. In Cuba, there's a large percent of Catholics and a religion called Santeria. However, both these religions do not play a role in health and do not impede in it at all. So let's talk about healthcare and community. So in Cuba, healthcare and community are very, very connected. For example, I was reading I was listening to a documentary where some people went to Cuba to study there, and they realized that doctors form very strong bonds with their patients, which goes on to the other point. And then just healthcare and community are very close together. For example, this doctor went to a community meeting, like a village meeting, and he saw that he heard that people were complaining about trash not being picked up. And so the doctor contacted the health institutes and told them how this is not only disgusting but also could lead to higher health problems. And then Cuba responded to this very well and fixed that problem, just showing how healthcare and community really play a role in Cuba. Now, another cultural difference is around the world, doctors are paid very well. However, in Cuba, they are paid very little. For example, on average, doctors make $60 per month. I even heard of a story where doctors are are becoming taxi drivers because they make more as a taxi driver, which just seems insane to me. Because here in the U.S., doctors are making tons and tons of money. Another thing, another cultural difference is Cuba celebrates this thing called Casa de Abuelos, and technically it's just this little day. It could even be weeks for certain people, and they just commemorate the elderly, and they just they do health checks on them. They talk with them. They make sure they're not lonely. They make sure they're not sad. Just that's just a thing they do, and I just found that to be a cultural difference. And then now let's just skip the doctors have strong bonds with patients. Let's just go to patients' resources. So, as a Cuban doctor, you have to understand that in Cuba, people don't make much money. So you have to be smart about certain things you tell your patients. So you can't expect your patients to be able to come to your clinic very frequently because they might not have the means of transportation, or they might not have time to take a break from work, or you just need to make sure you're working with your patients and you're not really hurting them in any way. So that's one thing you have to be careful of when you're a Cuban doctor. You have to make sure you're not hurting your patient in a way. So you have to kind of communicate with them. That's a big thing. You have to communicate with them, which leads us on to how do you respect cultural diversity in Cuba. So Cuba isn't very diverse, but still it can still have different cultures in them. So you don't want to make any assumptions, and the no assumptions goes to any country. You never want to make assumptions because you never want to make the wrong assumptions and then have the person get offended, or you do malpractice on them, or do something that goes against their religion. So you never want to make assumptions. And that leads us to our next thing. Ask questions. If you're a doctor, you want to ask questions about what they believe in, or if you could do this or you can do that, and then just work with them. Just make sure you follow their requests because it may be against their culture, against their religion. You never know. Don't discriminate. Just be nice to everyone, regardless of race, gender. Just treat everyone equal. And that just goes to every country, not just Cuba. And then feedback. You want to take feedback from them, from patients. For example, if they tell you, oh, this, just try to fix it or work with them. Just feedback is very important. Make sure you take it and you try to better it. Don't take it negatively. Just know that you can just fix it. Very great. And this is just how you can respect the cultural diversity of Cuba, but any country really. So then I made this little game, really fun. It's like Wordle. So I'm just gonna go ahead and open this up. Alright, so you're just gonna play this any Wordle, I guess. Okay, and then so the Wordle, I made it in a way so then the word you're trying to find kind of connects with the presentation. So I think this is, I don't really know. No. Oh, Cuban. So this is Cuban, right? And then you just wait. Next. Now this is a long word. So you could obviously, like I left the link there. If you want to go back and play the game for yourself, you can. Obviously, I made this Wordle, so I know what it is. I think this is client, maybe. No. Health. 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 Sorry, little confused there. But yeah, and then I just have a bunch of words, so you could just play this for yourself. It's right there. And then that's really it. And these are my citations. And then yeah, thank you for listening to my presentations. If you have any questions, I'm welcome. I'm happy to answer them.